Please open the chat for me too. Hi everybody, I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne and scars and pigmentation. I do a lot with facial balancing as well. I'm going to go through this case as well as other cases that I've been doing these last few weeks. Thanks again for joining me. I really enjoy working on patients' skin, and over the last couple of weeks I've been having patients who I haven't seen in a while, and I've been seeing the results that have been incredible. Sometimes I'm actually just kind of shocked by how fast some of the collagen production has been for some of these patients. And it's really interesting because I remember meeting them in, maybe sometimes a year and a half ago, and it was really something where like we had a different conversation. They may have been a little bit really dejected and sad about the fact that they didn't have as much improvement in the previous treatments that they were doing elsewhere. And it's really cool, really exciting to be able to see just this continuous improvement of their skin. So again, for those just joining, I'm Dr. Qazi. I mostly work on acne and scars and pigmentation. I do a lot with facial balancing, and I am going to be doing more treatments tomorrow as well. I'm actually going to be doing a couple of phenol peels tomorrow on some patients who have more severe scars. This particular patient, she had mostly ice pick scars and boxcar scars, and she had been doing treatments for a long time before she came to me. So it's really fun and exciting to see where her improvement is, and it's just been steady, really. I've actually seen her now probably for 4.5 years or so, and it's really cool to see that she just continuously has amazing skin. Hi Marshmallow, good to see you. Hopefully you've been doing really well. It's really nice to see you as well, and hopefully your week's been okay as well. This is a patient with actually sort of similar scarring as yourself. We discussed with you with your ice pick scars, and how you were worried about treating those kind of scars because you thought they were relatively deep. And look at this, it's so significantly improved. It's really fun to see, right? Thank you so much. Yeah, I appreciate you. Thank you guys for joining, and I'm on a couple different platforms, so bear with me. I'll try to get to all the comments and questions that I get, and it's possible that I'm responding to something that's not necessarily on the platform that you're on right now. Claudia, nice to meet you. Thanks so much. What time is it over in the UK right now? Appreciate you. I have a lot of patients in the UK. We actually just recently had a patient come from the UK. And it's a pleasure really to work on patients from all over the world. 2 a.m. Thank you so much for calling from over there. Is this a product? No, this is actually from actually ablative CO2 laser around the edges of the scars. I did a full field erbium laser as well, and then I did a TCA as well as Bellafill. This particular patient, she did actually require 4 to 5 sessions just to get to this improvement, but we actually still have been working on it, little bits of tweaks here and there. And she's done a few more sessions. She is somebody who just wanted as completely smooth as possible. It was just really important for her because she was really suffering for a long time with her acne, and then afterwards with the scars. And she's public facing, she's very prominent, and was very concerned with the fact that she thought that people may have noticed it, or just herself, she just didn't feel as comfortable with the fact that she had these scars. And I think that was something that I noticed immediately for these patients, is that when we are working on their scars, when we're working on their, sometimes their pigmentation, there's a lot of baggage, there's a lot of things that essentially, people suffer from for a long time. And it's really remarkable to see that difference over time as well. This is actually not from filler though, TaxPro. This was well, some of it's filler. There's like little areas where there's some pockets of fat loss there. So I did filler for those, but really it was more like TCA laser, and I sanded that down really effectively. And that's how I ended up getting this actually really well. Thank you so much, Let's. Please answer. I'm getting a lot of questions, so if you could just repeat the questions. If I haven't seen it's possible, if I had an answer to, feel free to just repeat that same question, and then eventually I'll try to get back to it, because it's really hard for me to go back up on the chat. And again, it's like on a few different platforms, so I'm trying to answer everybody, and I see like this, the chat for everybody, so I don't want to miss it, but just repeat it then for me. I really want to work on my skin this year. I had lasers, but not CO2. It's not that you have to do a CO2 laser. It's possible that an erbium laser could work very, very well. Or if you have more pigmentation, then something like the pico laser could be a great option. Pico laser works on breaking up pigmentation. Also, it's something that works very, very well with stimulating some collagen over time. So it may be a great option if you're somebody who is suffering from pigmentation, suffering from so just a little, like just really you want to stimulate collagen without much downtime. Pico laser could be a great option. But if you're somebody with like deeper lines, wrinkles, or scars, maybe a CO2 laser is what you need to do. It just all depends on what your skin type is as well, and what kind of scars you have. How many sessions of laser would be needed for moderate boxcar scarring? It may not be a laser, it may be TCA, and TCA needs several sessions. Why does it sound like we're not? Oh, sorry, there's an echo there. I'll try to fix that. Maybe just my mic there. Maybe if you could hit the fan there for me too, please. I'll try to fix that there. Sorry about that. Let's see if this will be better. Is it better already? Hopefully, because I changed the way my mic is set up there. I have two mics there, so maybe it helped. Is Belafil good for scarring? Yeah, it can be great for scarring. It's just that there's some patients when they have some fat loss, and you have to do something for volume replacement. And really, there's still an echo. Let's see, I'll try to push this back further. Let's see if I could do it this way. So yeah, Belafil work very, very well for scars. And it's something a lot of times what people don't recognize is that a lot of times the acne that they see it really has affected multiple layers of the skin. And then what ends up happening is that as your body's attacking that acne, it sometimes destroys the skin and sometimes fat cells underneath there. And you can see fat destruction in a lot of these scars. And that actually really needs some sort of volumization, whether that's fat transfer or if that is potentially Belafil or Sculptra or Radiesse. Something for volume replacement is necessary for our patients when there's fat loss. Have you had experience with scar correction with Ehlers-Danlos patients? Yes, absolutely. Actually, I've had many patients with that. I have many patients with EDS. It is very much like a situation where I think that it was sometimes missed for many, many years, which is understandable. It can be complex for patients, really, or I should say practitioners, to understand that it is. Oh, there's still an echo. Okay, let me see if I could try to sort that out a bit more. I'll try to adjust some settings there. Sorry about that. But yeah, EDS essentially is where there's a lack, or I should say poor collagen production, and the skin can be very stretchy. And we still could get good improvement. It could still improve over time as long as we do a few different steps, and we don't want to go a lot of times with very aggressive forms of the laser, but we do need to do sometimes quite a bit of volumization. Sculptra, for example, could work very, very well. And we want to do that because we want to make sure that we have something that's going to stimulate collagen and elastin production. And so yes, EDS, sometimes you don't necessarily have to use as much laser, or you don't want to use as much laser or too harsh of a laser, but you may want to do more things like collagen stimulation. Sorry, in my consultation you put me on laser. I forgot to ask how many sessions I need. This is for us. I don't remember offhand how many sessions, but I remember vaguely that I believe I was thinking, at least I thought I told you, but probably close to about 2 sessions is for the vast majority of that. Sometimes it could take more though, depending on how thick the scars are or how much improvement you want to get. Is there still an echo, by the way? Well, I just turned off the other mic. I changed it a bit there. If there is, I could try to change something else though. Let me know if there's still that echo there. Opinion on toners. I grew up in the 90s for acne. Sorry, still an echo. Okay, I'll try to adjust that a bit more still. And I grew up in the 90s, and at that time it was just like harsh toners, and it was really, really terrible for my skin. And I'm not a fan of most toners. I think there's sometimes there could be a bit hydrating ones out there, but there's just not really much of a need for it. So stick to like just things potentially like really simple. A face wash, potentially like a Cetaphil, CeraVe, gentle cleanser, a moisturizer like Vanity Cream. That works out really well. So let's see. Testing. Okay, let's see. Hopefully that fixed the echo. I'm not sure. Let's see. Hopefully. Although my office is a bit echoey, so let's see if that maybe is going on. If you have Belafil and you want it reversed, lessen the volume and you're not happy, what's the risk? It's going to be tough to do. I mean, you can potentially do something where you reduce it with steroid shots. You could do something with steroid shots. but it may not actually be enough, because if they're put too much in one area, it's more for like that collagen production that it reduces. But if it's more of like the Bellafill PMMA, then that's going to be very tough to break up unless you do like subcision, some laser. And I would just say it's extremely rare for anybody to say that, even for places that do a lot of Bellafill, or they did a lot of Bellafill in the past and they overly filled up HPL. I don't hear too often where it's like clumps of it, and I really sometimes just doing a little bit of steroid injections, and then sometimes doing something with a laser or Morpheus 8 can actually work really well at reducing it. And you combine the steroid with something like 5-FU, that can help out there. Hopefully the echo got fixed. I tried adjusting a bit there. Is phenol peel too drastic for a 24-year-old? I mean, I've done it on, actually, I think it was last week I did. The patient was in her young 20s, and she said more severe scarring. So if it's really a situation with a more severe scarring, we have to do that, then yes, we may have to do it with that. How do I do the Bellafill correction without steroids? You may not even need it with steroids. Maybe it's like with subcision. Maybe you just have to blend it in or so. Let's see exactly what's happening with it. It's possible that you don't have to do it like that. Maybe it's not as bad as you think, and we have to just solve it with like blending it in elsewhere. Maybe it's because one part of the face is volumized and right next to it it's not volumized, and that's why it looks like that then. Do you recommend microneedling? Really, like for more like mild like skin texture or something like that, but definitely not for these scars. This patient, I think, did 10 sessions of microneedling, so it didn't help her out. Is a combination of V-beam laser, CO2 laser, and subcision with fat graft good for chin trauma scar? I don't know offhand. It's tough to say. It's tough for me to envision like fat transfer being great in the chin per se, because it could really displace pretty easily in the chin area. So I'm not so sure if that's the best area, to be honest with you, for fat transfer. I don't really think it would be. And the other problem is that in the chin, you want something that's not going to move, and you want something that's going to last. So actually, I prefer Bellafill. It works out really well for that area. But I'm not sure. I don't know if there's exactly a reason why your practitioner decided to do fat transfer over there. It's just like not necessarily the best place for fat. It could be something that shifts over time. I had a patient that we had to do liposuction on. He had done fat transfer elsewhere on the chin and even the jaw area, and it ended up just like getting displaced and dislodged below the jaw, below the chin, and we had to actually do some liposuction there. Dr. Qazi, is it safe to introduce Bellafill to a skin that has an existing different filler already? Yeah, absolutely, you could do that. There's a lot of times it works out really well. It works hand in hand with that. Reason why is because Bellafill is made out of cow collagen and something called PMMA. Sorry for the echoing. Thanks for still sticking with me. I'll still try to work on the echoing. I'm not sure why it's doing that, but I'll try to still solve it a bit here. Thanks for staying with it. Right? Yeah, Bellafill is basically made out of a different product, and hyaluronic acid is something that is going to draw in water. A lot of times it's a product that you place a bit differently than you would with Bellafill. Even if you're using something like Sculptra, it's like more diffuse. Bellafill is like more discreet in certain spots, and it can play really well with other products. Sometimes I do it at the same time actually, and then you could really have no problems with it. Can you please tell me where you're located? I'm interested in making an appointment if you're local. I'm over in Newport Beach. Most of our patients come from out of state though. Most patients today came from out of state or just or Northern California. So we are just 5 minutes away from the airport over here, but we're in Newport Beach, California. I'm trying to fix the echo situation. Hopefully it's fixing it right there. What are the levels of severity, the main types of scars that you would recommend a phenol peel? Well, it depends actually. If there's, first of all, patients have downtime for it. If there's something where you have a lot more texture, it's like thicker, there's thickness around the tissue, or the scar, then actually it could be a great option, because we could use the phenol to stimulate more collagen production, and then we could use a laser potentially to sand it down, or dermabrasion to sand it down a bit more, and you can do that the next day. It works out really well. I'm in Michigan. I want to come though. Yeah, absolutely. We actually have a lot of patients from Michigan as well. We'll be happy to help you out. Just message us and let us know at some point. Thank you so much, Shay. Good seeing you on, by the way. Please, Dermapen for this. Dermapen is really not going to help much for that. It's really not going to help much for that. It's really, I mean, this patient did so many sessions of microneedling, about 10 sessions of that. It did not help. It could help with a bit of like mild texture, but it ends up being a situation where people go down a wrong route with something like dermapens or microneedling, and they ended up wasting a lot of time, and they ended up thinking that just nothing's going to work out for them, and it gets really sad for them. Could you recommend a sensitive acne-prone skincare to keep at bay, please? It's actually very common for a lot of patients with acne to have more sensitive skin, and sometimes what ends up happening is that they have an underlying rosacea as well. They have underlying rosacea. And what we want to do actually with this is we want to make sure that what we do when we treat these patients, let's say we work on their acne and we manage their acne really well, then sometimes what we want to do is we actually do things where we control the rosacea better as well. And rosacea looks and mimics acne many times, and so you have to sometimes do things to control the acne a bit better. And ways to do that would be, let's say we control your acne with just more mild topicals, things like Cetaphil Gentle Cleanser, something like a Vanny Cream, and then you may want to use like at nighttime azelaic acid could work very well. Azelaic acid, like 10-15%, could work very well. You can get 10% over the counter. And if you have even rosacea, that's actually a good regimen for that. But maybe you may have to do something more direct for underlying rosacea. Natalia, we stand by all of our work, so if you would like, just message us and we'll take care of it. If there's anything that, like for pigmentation, sometimes there's a lot of different variables. If it's melasma, hormones could fluctuate in the future. Things could still occur. So sun exposure could still occur, but we always take care of everybody, so we always make sure that everybody's satisfied. Especially, things like pigmentation. I've been doing it now for almost 10 years of just doing pigmentation. I should say of really focusing heavily on pigmentation with my scar patients. I really wanted to make sure that we could clear up hyperpigmentation. So we do a lot with melasma, a lot with sun damage, and absolutely would be happy to help you with it. So it's something that we pride ourselves on, and it's possible because treatments may have fluctuated or need to be changed, and you need to see me. We'll be happy to help you with that. Do you do the microlipo that is offered at your practice? I do sometimes. It depends on where we are with the schedule. But a lot of times I just have it with my partner, and she takes care of those. So it just depends. And I do more like the skin tightening portion of things. So we do like face tight and work on just on helping with the tightening and contraction of tissue there. But she does a great job with microlipo as well, and then also with that face tight portion. I have Ehlers-Danlos and bad acne scarring and large pores volume loss. Is phenol peel a bad idea? Not necessarily a bad idea, no. There's just a problem is that it may actually, as the tissue is healing, it may not be as predictable of a healing process as we may like. So I probably would prefer to do other treatments first, especially with volumization initially, like things like I was talking about earlier with like Sculptra work very, very well for EDS patients. And Bellothil maybe, but Sculptra works very, very well. Like also a product which is made out of calcium. Dilute Radiefs could be a great, great product. And then we can slowly build up that tissue, the volume, and then we can see if we need to do much with something like a deeper chemical peel like phenol. It's possible we don't need to. And I don't want to have something where, because of the lack of collagen production, we don't have an optimal result, or potentially it's not as a consistent result as we may have gotten with some other patients. Dermapen, yeah. So I don't really think Dermapen is going to help much at all for deep pigmentation, especially ice pick scars. Really I'm not a fan of that really. I think that's stamping is okay, maybe a little bit, but it's really not helping much. So sorry, user 42. Thanks for sticking on though. Despite the echo, I'm still trying to work on the echo. I'm just trying to play around with it a bit. I'll try to adjust it in the future. It's just a different area in my office here, so it's sorry. I will try to figure it out though. Let's see here. Let's see. I'll adjust something here a bit here. Let's see if I can get something where if we adjust this way. Sorry, just a moment. I'm trying to fix this situation with this mic. Oh, that's why. Okay. We gotta change. This is not this. Yeah, we gotta put this in there.
No, it was before.
Oh, okay. I'm gonna fix the echo. I think. Let's see. Unplug the mic. I'm unplugging the mic for you.
I already unplugged it.
Oh, okay. We'll do that.
So that's a different.
We're in Newport Beach, California. Newport Beach, and We are just about 5 minutes away from the airport. Sorry for the echo situation. We'll fix it. Let's see here. I'm 16. Do I help with my acne marks and acne? I use Cetaphil, Cloprim, and Clearwin. How do I help with my acne marks and acne? Well, what do you have? Do you have like cystic lesions? If you do, you really need to be on some sort of topical antibiotic. Something potentially like dapsone could work, well, I should say clindamycin could work very, very well. But the other possibility is that you have to do something more for, oh, I figured out the mic, by the way. Let me figure this out. I got it. Okay, there. I think it should be better, hopefully. Did I fix it? Fixed? Maybe. Hopefully. Okay, so I lost my train of thought. So basically, if you're saying you have acne, essentially if you have cystic lesions, you could do something like a topical antibiotic like clindamycin. If you want to do something that's just more like you could do sulfur-based creams. It's not fixed. Okay, I'll try it. Work on this. Sulfur-based wash actually works well. Dapsone is another product that's a prescription-based. Could work very, very well. Hang on, just one second. I'm going to try one more try to fix it for this mic situation here. It's the first time it's happened where it's more of an echo here. Let's see. You did Dermapen for that scarring? I don't think it's going to help much. Let's see here.
Maybe he's trying to pick up on both, so maybe shut this one off, the Osmo.
Yeah, that is.
And then just leave it for this mic.
Okay, that should work now, hopefully. Okay, that should test. Echo better, I think, hopefully. Echo? I think echo's better.
It's a lot, yeah, it's better.
It's better? Okay, cool. Echo's better, right? Fixed it? Thank you so much for hanging out there. Thank you so much. Appreciate you guys. And thank you for telling me. I appreciate you guys. I appreciate you guys so much. Thank you so much for that, by the way, and just waiting around, because that was, I know exactly what the problem was. I was going from 2 different sources there, because I'm doing it on like a couple platforms, and it was like doing that. Okay, so, oh, hi, Ari. Thank you so much. Appreciate you. And yeah, I'm doing it at this time right now, so appreciate you, and just right after work, and this was a little bit of a different format, and I'm still fixing up a couple of bugs here. Thank you so much, Andy. Looking forward to see you too. And do you go more mild with CO2 on olive skin? It depends, you know, if you have more severe scarring and you have the downtime for it, I could still do it. I did it for the patient earlier today. She had very severe scars and she's okay with the downtime and the recovery. She just wants to get it solved. She came all the way from NorCal, and I understand, you know, and I worked on it and I tried to get it. It's, you know, still trying to balance out for safety purposes, but we absolutely could do it. Just let me know how much time off you have. I think that's what matters. If you don't have enough time off, then you know, it's possible that we have to adjust our treatment and modality and our energy. But if you do, yeah, we can absolutely do it. You just turn off the speaker over there. What's the consultation fee? You actually could do it directly on our website at drqazi.com. It's $150. RF microneedling with PRP better for olive skin tones. I tried it so many times actually, and actually this patient tried it as well. You know, it's not something I think that was great for acne scars. I think that it's okay for skin tightening. It helps a bit for skin tightening, but it's really not great for scars. I think in fact it actually can make it worse sometimes because they get destroy and melt fat. That's actually the biggest challenge that I see when people are suggesting to do radiofrequency microneedling. And a lot of times you'll see it where someone will say, well, your skin type is too dark for laser. But you know, you should be a candidate for RF microneedling. What ends up happening though is that it actually is a lot of times useless, or sometimes it actually can melt fat. And you see this over and over and over again where that's the case. And people are melting fat, and you need fat for anyways for aging purposes, and then especially when we're talking about for scars, you want something like that's going to support those scars. So the last thing you want is to melt fat. Fastest way to get rid of red acne marks pigment. It's tough to say the fastest way per se. It could sometimes still take a long time, and you know, like a temporary. If you're like saying, well, I want something as like a temporary quick fix, you actually could do a little bit of Visine. A little bit of Visine actually could work well. Just do that like before a party or something like that, right? But like actual real fix is a lot of times a laser that reduces the capillaries. So you actually could use the laser so your body can absorb those broken capillaries. Topical cream over the counter that you could try is 10% azelaic acid. I find it pretty weak though, to be honest with you. Sometimes it doesn't really help enough, but it's like, oh, well, it reduces some of that inflammation a bit, and it may help a bit. And that may be all you do before a laser. How far out are you booking? I think June, I believe June, but we will try to work with you, and you know, there's sometimes just cancellations, things like that, but I believe so. Is what I was told. Love Lena saying, I've asked lots of times, please advise. I missed it. I'm not sure what you asked. If you could just hit me again with that. Can you do laser after phenol peel? Yeah, absolutely. Actually, sometimes I do it the next day. Sometimes I do it the next day. Reason why is because it's like we got these layers really well, right? When you do the phenol, the layers of the skin are looking amazing the next day, and we could just do a little bit of dermabrasion, so we sand it down a bit there, and I could see the scar depth very well, and I could hit that with a laser, especially the edges of the scar, and it could work very well. I'm going to be doing that tomorrow actually, and it works incredibly well. I usually do about 1 to 2 phenol peels a week. It worked very well. I have a pneumothorax. Well, that sounds like it may be a medical emergency. You should really see. I mean, if you have a pneumothorax, I'm not sure if it's something that's stabilized right now. Assuming that it's it's stable, awesome. If it's not, really go to the ER and get that worked out, because pneumothorax. I don't know. Is anyone here in the medical field right here? Anyone have to throw any chest tubes in anybody or anything like that? It's like, yeah, pneumothorax is a real serious situation, but it's crazy. Like, you could have somebody who's so unstable, and you put it in a chest tube or do something, and that's like even a mild like needle decompression, and it could work incredibly well for patients. And if they're unstable, you put that chest tube in and it could solve it, and it's like life or death situation there. Did you say phenol peel? So phenol and CO2 after. Yeah, so you could do a phenol. You could do basically what you could do is you could do the phenol, and then the next day you could do like an erbium laser, or even sometimes a CO2 laser if it's needed. Hi doctor, what do you think with subcision combined with Juvalook? I've had a lot of patients who tried Juvalook. A lot of people tried it. They didn't really say that it helped much though, to be honest with you. It's maybe like a little bit, but most people say it's like, yeah, it's pretty mild, not enough. Do you know any specialists in New Mexico? My patient last week came from Albuquerque. She tried a few places over there. She said that they're okay for like more mild things, but it depends on how deep the scars are. You know, she said there are people that have some lasers, things like that, but they certainly don't do a combination treatment. They don't do things like TCA and laser, things like that, and altogether, you know. So I don't think that's going to be the best option. How did the skin change? We did CO2 laser around the edges of these scars. We did erbium laser as well for like blending it in. I did some subcision as well for this patient. I did a little bit of Bellafill in the deeper parts of the scars. So I did a few things actually. But I did it a few times actually. It wasn't just one time in this case. She wanted like pretty smooth, almost perfect skin. She just wants, like, she's someone who's very public facing. And I was actually very hesitant to share photos, but like I really appreciated it because she is so public, and just something that was insecure. Actually, you know, it was like, you know, mostly not too visible, she said, to other people, but just in her own face, like she thought that it was visible to herself, and it reminded her of the trauma she had. 19 years old with Ehlers-Danlos syndrome, topical clindamycin and tretinoin, pores are so enlarged and bad nasolabial fold. That's you know, unfortunate because of the condition that you have, where you may already be noticing that there's some more skin laxity in your face, fat loss as well. Things to consider really would be still laser. It still helps out. I would not do radiofrequency microneedling at all in your case though, because it could potentially melt fat, which you need. I would not recommend it, especially for the way that most people do it. And a lot of people, what they do is they go too hyper, they go way too strong when they're doing radiofrequency microneedling, and it can melt fat. And that's the last thing I want to do with someone like you. But if you do something more like potentially where we're looking at this, and you do a little bit of like Sculptra, it can actually work well. Even at your age, it actually could work very good and help you age well over time. I will get Dermapen first. I'm scared to try anything more. You should try it. I mean, go for it. Do it. Let me know how it goes. Give Dermapen a try. This patient did about 10 sessions of that. She did microneedling multiple times, and you know, she was not satisfied enough, but it depends. I don't know, you know, it's possible your scars are not that severe. It's possible things are okay. And if you're not comfortable, just do what you feel comfortable with. Always do what makes sense to you, and start with that. And like, then we'll end up working out with this. Let's see here. Can you do online consultation? Yeah, most of our patients do it online, actually. Most patients come from out of state as well. I'm happy to work on it with out of state patients all day long. And so, yeah, absolutely. Can I do subcision and CO2 lasers while taking low dose Accutane? Yes. Many times you can, as long as the acne is well controlled, the oil is well controlled. We can absolutely get that. And just repeat the question, because I have a lot of questions that come through. Just feel free to repeat it. I'll be happy to help you with it. We're in Newport Beach, California. Where are you based, actually, user? I did a Halo BBL and that didn't help with my pitted scars. You know, it's unfortunate that it's pitched as a treatment for pitted scars. It's going to be a really mild improvement for scars. Sometimes it can make some scars worse even. But there's a lot of options that you could potentially have that don't involve even lasers. Like what we could do with this patient, for example, was TCA. We did some subcision. We did some volume replacement. We did do laser, but it was on the edges of the scar, and then I blended it in with another form, which was the erbium laser. Excited to be. Let me know if you were on here. Then I'll be happy. I'll be very happy to see you in person. Are you coming in, or are we doing a virtual consultation? I have acne scars and loose skin on my face, but I'm only 26. What can I do? That's actually interesting. Did you have a lot of weight loss? Because at 26, I mean, I do see it sometimes, but it depends, you know. Hi, doctor. I've had dermabrasion and CO2 laser with no effect. Will it work with subcision and lipolifting, meaning filling the subcision area with my own fat? That's very possible. It sounds like you did a lot of aggressive treatments. So I guess it's Hamdu saying I've done dermabrasion and CO2 laser with no effect. Will subcision and fat transfer work? You know, so you're on the right track, because it's likely possible that you had it really stuck and pulled down with your scar tissue, and you had to break up that scar tissue, and something like subcision is necessary, and then you have to revolumize your face, and we could do that with potentially with fillers or fats. All good options there. So you're correct that maybe that is what you end up needing, especially if it's more rolling scars. A patient gets burned by laser, skin damage for life. No, actually, that's not the case, Sheikh. There's many patients who I have worked on who had laser damage, and you do low heat, low energy lasers. Even like an erbium laser could work really well. You could do a pico laser, it could work very, very well. You could place patients on a little bit of a low dose of tretinoin. That could work really well. Yeah, absolutely. It's not like it's a damage forever. There's a lot of different options, and I think that really, you know, and in fact, you know, I've had physicians who had reached out to me because they, you know, potentially had caused or they were worried about laser damage that maybe occurred when they did treatments, and I basically helped them with some of those sessions, and then it actually really rapid improvement. You know, I talked to them about it and worked on it with them, and it worked out very, very well for them. You know, there's no subsequent damage afterwards, and that was something that they themselves fixed over there in their own practice. So it's absolutely things that you could work on, even if you have some laser damage. It's not something that's like a life sentence there. I had Rejuron injections on my cheeks. How was that? How did that go with you? Can I send photos of what you recommend will benefit me? Yeah, you could absolutely just schedule a consultation directly on our page at Dr. Qazi. We'll be happy to help you with that there. I'm 17. I have a lot of acne scars, like rolling scars. What do I do? You could actually break up that scar tissue with subcision. I'll just wait till you're 18. In the meantime, just things that you could do is just make sure your acne and your oil is well controlled. If it is, then we could work on it then. Let's see, I've seen progress immediately after, and my skin healed pretty fast compared to others. That's awesome. Oh, hi, Lucky Singh. Good to see you as well. Thank you so much. How do you feel about radiofrequency microneedling? I'm not a fan at all of that. I really am not. I have found many, many times a lot of patients find that there wasn't much improvement. Sometimes people have actually found that they lost facial fat because some practitioners just go way too much with their energy settings on like devices like Morpheus 8, for example, and they maximize their settings or just try to go really strong because they're told that, you know, there's going to be some collagen stimulation. You have to go really strong with that. And it'll be really like catastrophic for patients if they lose a lot of that facial fat. For aging purposes, like as you get older, you need that fat. And then of course for scars. Oh, good to see you on, Maine. I haven't seen you in a while, actually. Oh, good to see you. Hopefully your skin's been doing really well. Which laser is best for under eye rejuvenation for mature skin? Now that's a good question. Okay, so typically for patients who are older, we may want to do something that is going to involve a bit more skin tightening. So a CO2 laser could be a great option. But the other option could be potentially doing something like just an erbium laser, low heat, lower energy, And now actually may combine it with something like radio frequency modulating if you're the right candidate. Godard is saying, hi doctor, do you think it's beneficial to gain some facial fat before starting scar treatments? You should be at closer to your baseline weight. You should be like where your normal healthy weight is going to be. Don't like overshoot it, don't undershoot it. Just be like at a normal, natural weight for yourself. It's like it really, if you're somebody whose weight fluctuates a lot, it can end up being a problem there. Oh, I didn't realize that. You can't see me as well on this here. Let's see. I have a funeral pale in 3 weeks scheduled with you. Thank you so much. My teenage life has been ruined. My teenage life has been ruined by acne scars, rolling scars, vascular scars. Couldn't afford to provide treatments. Sorry to hear about you, that. My confidence, my motivation has died long ago because of my face. I am so sorry that that happened to you, Bangalore. He's saying, please give me a new life. You are like God. You have all the power. I definitely, I appreciate the trust, but the truth is that there's a lot that's involved with this, and there's some things that are just completely out of my hands. There's things that we could try to control to get so you get the best possible results. But I will say that many patients, people on here as well, will also report that they were suffering from acne and then also the scars, and it affected their self-esteem, myself included. And I would say that really it's interesting because you'll see, and like I was talking about earlier when I started this live, that I've had patients that I haven't seen in a couple of years, and you see the huge difference that they had over the course of these couple of years, where their confidence has changed. It's really like it improved their life quality. And it's really cool to see that. Really a great feeling to have, because some people, they really felt really depressed, and they were concerned about potentially even, the fact that they couldn't live. Or some people felt that way, and it's really like why I say that we have to do this properly. We have to take this responsibility really seriously, because there's a lot that's at stake with this. We got to make sure this is done very well. We gotta make sure this works at a very high level. And I do my part. I try to do my best to get to that kind of improvement. But there's certain things that maybe we could do to get things better. That includes getting things optimized for oil production. Sometimes doing a laser that works on the oil production. Sometimes doing low dose or microdosing of isotretinoin or Accutane. Also, anti-inflammatory products, potentially, I should say, like reducing inflammation. Things like dairy intake, that's a really big factor. Stopping vaping and smoking, that's a huge thing. This year, my goal is to get more and more people to stop vaping. That's one of my biggest goals in life. I'm gonna just try to go after that tobacco industry at like a really aggressive level. That and the dairy industry, to be honest with you. Both industries are really suspect. But especially the tobacco industry and like just what they did with hooking so many people on vaping. It was like my generation, I'm 43 years old, and people my age stopped smoking, but it really got, they really got the people in their 20s. They really got it. And it's you see it over and over again because of the way that they pitched it. And I see every time I deal with patients who vape that they have significant scarring. That has a particular signature. A lot of times there's like these ice pick scars, and they're very deep and they're very thick, and you can see especially when you're doing subcision, for example, you can feel it. Like there's so much fibrosis inside there, and it's over and over again. I see that with patients who vape. So I really strongly consider quitting vaping. Really strongly consider that. I think that it's like one of the biggest things that's a barrier for great results, if you haven't stopped already. And actually, it turns out many people have told me that they stopped smoking because of me, and I thank you. That's awesome. Thank you. Let's see. Pia is saying, is there a reason why you don't use silicone? And do you not suggest subcision in some cases because it can cause more skin laxity? That's a great question. And Pia, there's a few things really with it. One is that, first of all, I've seen a lot of adverse events myself of people who've done silicone elsewhere where it has formed not necessarily like granuloma per se, but it has gotten thicker, and it's very difficult to reduce that. Very difficult to reduce that. The other thing is that the FDA, which has its own issues, but the fact is that they actually went out of their way to put a letter out saying do not do injectable silicone. They went out of the way to say it. They said don't do injectable silicone. And I think you should take it seriously because there's a lot of complications that aren't even reported. And it's not the best product that people try to push. It limits actually your ability to do other products potentially. So I would highly recommend not doing that. I would really highly recommend not doing silicone injections. I think that there's a lot of better products. The only FDA approved product for acne scars at this time is Belladonna. But of course, we could do other products like Radiesse or Sculptra or even hyaluronic acid filler or fat transfer, all options, but they each have like their pros and cons. So of these, like I think there's a lot that we could do with Belladonna, for example, and you don't have to do something that potentially could cause more complications like silicone. And it's just not fit for injections. It's just not appropriate to inject it. Can you show an example of elliptical excision? I was coded, but I haven't seen any of your before and after. I showed it last week. If you could just reach out to my team, because it's hard for me to change the image right now, but I could show it next week or so too. But like, if you could just reach out to my team and we could send you or showcase that for you. We're changing the way our website's going to have with the photo gallery. It's going to be like where you can tag it really well. There's certain tags on there. You'll be able to organize it really well. It's been a project. It's going to be amazing. It's going to be really cool. We already worked on just the prototype of it. It's going to be very, very cool. You'll see what happens very, very soon. So it'll be a lot more organized for some of those photos. But in the meantime, though, just reach out to my team. We'll be happy to send you that particular one for a patient or a link for the patient that let us share that result for elliptical. It looks incredible. In fact, actually, I had another patient that I got to double check if he lets me share. He had an elliptical. And he comes all the way from Chicago, and it was a very deep, thick scar, and it's pretty close to scarless at this point. It's about a year and a half out. I did the elliptical procedure that day, along with actually two ellipticals. I want to say two elliptical procedures, elliptical excisions, and then we subsequently did some laser and Belladonna. It worked out very, very well. So yeah, we absolutely could do that there. I know I missed a few questions, so again, bear with me. I'll try to get back to everybody. If you think that I missed you, just feel free to repeat it because there's a few platforms I'm trying to keep up with everybody's, and hopefully no more echoing, which is awesome. I'm on Accutane. It's my 4th month. Will it clear my skin? Can you tell me I need to be careful? Accutane could be awesome for it. It could be great. You could actually do a couple things though to maximize your result though. Consider doing the following. You should do zinc, 125 milligrams of zinc. You could also take fish oil, which works out really well. And then the other thing is actually you could do something where you do a little something sulfur. Sulfur actually works very, very well. Hopefully just don't overly dry your skin with it. Just do it once at nighttime. But sulfur could work very, very well. And then do that with, which is a lot more moisturizing. Because what happens is that you can end up drying your skin so much with isotretinoin. And then as you dry up your skin, your body tries to produce oil production, to produce more oil, and then you could trap some bacteria on the surface of your skin. Doc, I use a Dappling moisturizer at night. Is it okay to wash my face in the morning with just water? Yeah, that's awesome, actually. You should definitely do that. Definitely don't do too much with aggressive face washes, toners, things like that. Water is totally fine. Although, a lot of people have been reporting water has been terrible. The quality of water is terrible in this country. A lot of people don't even know that in LA, this Palisades fire exposed a lot of this, that LA actually sold so much of their water to a guy who's like a dual citizen and they sold it to this billionaire. And we don't even have we don't even own our own water. LA actually then buys it from this dude. And the water quality has been garbage. So a lot of my LA patients report that their water is really bad. So if you switch it to more filtered water or use bottled water, things like that, it actually reduces some of the inflammation too. Again, there's a lot of things I want to go after. I want to go after the vaping and the dairy industry, but water is a whole other thing that actually people really, and it all relates to what we're dealing with, because these things actually cause inflammation. All these minerals that they're putting in the water, all the junk that they have in there, it's really causing inflammation. And some people get rosacea, they just get more irritation. And you probably have to take a look and see, maybe you should reduce it. What's wrong with dairy? Dairy is really inflammatory. It can increase more IGF, which could increase sebum production, which could cause more oil production. It's one of the easiest things to cut back on. If you have more oily skin, it could work well. Yeah, dual citizen. You know what citizen of which country there? Go Max is saying, Dr. Qazi, my skin is healing so nicely. Can't wait for my next year. Awesome, Go Max. Appreciate you, Max. Thank you so much. Harneet is saying, what is the best laser for hyperpigmentation? Isn't it, and is it normal for your face to be 4 shades darker than your chest? It's not normal to have that. I would say that that means that we have a lot of work to do. It's really possible that you do lasers, but you also should add probably peels with that. And we work on so much with pigmentation, so much of it. We'll be happy to help you with it. Just schedule a virtual consultation or in-person consultation. We'll be happy to come up with a program for you. Things you could do over the counter, just something you could try. Try Eucerin's pigmentation cream. They have a patent on it. You know, it's unfortunate, but because like it's a really great product, and I love it for like other people to combine it with other things, but they just like, you know, they have it and you can't do much with it otherwise. But Eucerin's pigmentation cream can work very well, just like a lighter way of gently helping with some of that hyperpigmentation, suppressing some of those melanocytes. And just, you know, it could take like 3 to 6 months sometimes to see it getting lighter, but it will help actually. What's your opinion, ChatGPT, for finding out skin issues? It's so accurate. Yeah, I mean, they did a lot where they took a lot of our photos and they trained the models off of that. And you know, no joke, I'll tell you totally seriously, I discovered that like things like Gemini were looking at like my lives and stuff like that, and like on YouTube and all these platforms, and like they were actually training their models off of that. They legitimately were training the models off of that. Crazy, right? Like I didn't give them authorization to do that. You know, it's wild. It's wild. And they actually passed this law that said that these guys could just do this and nobody could do anything about it. And so like they did that, or it's just like, you know, and like I'm actually fine with people like learning and educated and things like that. But like it's really ridiculous when it's like they're just taking my stuff and like with like just like without attribution, and then just like it actually like I discovered it. Like I found that like you see where they reference it and they said it. They showcase where it references it, and it's like, oh, that's cool. You got my YouTube video and the transcript for my YouTube video, and that's what you ended up doing is like a explanation for this. And like, okay, you know, like I didn't give you authorization for that. And that's what they did. You know, they used like, how do they train all these models? They took it, a whole bunch of stuff from you know, Pirate Bay and all the other things. Anna's archive, by the way, great, you know, great source for a whole bunch of documents. This is what these guys did. They trained their models on like from Anna's archive, which had so many different books and everything. And then and then in the meantime, they sued the dude that was like had founded Reddit. You know, that guy had used a whole bunch of books that he like downloaded from like Pirate Bay or something like that. And the poor guy killed himself afterwards because he was going to go to jail for that. And then like these same LLM companies now, these same AI companies just did like a crazy scale, you know, hundreds of terabytes worth of data that they just took. And then, so, but you know, I would say though that for purposes like AI purposes, things like that, it's possible it gives you sort of a right general direction for like what kind of scars you may have potentially. But it's, you know, the other thing is it's basically not like a true intelligence. It's like a parrot, you know. So it's possible that it misses certain things. It's possible that it's not understanding the nuances of certain things, and which, you know, people understand. It's okay, but like, you know, just recognize that and see it. And by the way, like really, nobody should be using ChatGPT. There's great services out there that like are amazing. You can use Qwen, which is amazing. Kimi is amazing, and they're open source too. You can actually run those models on your own system actually if you wanted to. So like try to use those, and don't use these guys who are like stealing your data and harvesting your data, and you know what they're doing it for, you know. And they're going to put people in databases, and we all know. Hopefully, everybody saw what just happened over the weekend with these, with everything that happened with the files that were released. 3 million were released. There's another 3 million that needs to be released, and it's like you guys just like everybody like we've been talking for a long time. It's like really clear as day. Like don't give your data to these guys anymore. You know, it's just like what they're going to do with it. Who knows down the line? One day you're like think, okay, well you're not like big enough for them to do something, and suddenly you can get bigger and bigger. And it's like, now what? You know, now you give all that data, all that information to them, and you know, get visors. Get the visor to help you with your UV damage and also for facial recognition. I would say that. Get visors there too. Hi, doctor. It's Julia from Montreal. Good to see you, Julia. My skin is healing very well. My forehead is still swollen, though. I guess it'll take an extra 7 more days or less. Probably a little bit less than that. But I'm glad it's healing well. It was a little bit thick, with the scar tissue there. But sometimes it could take a little bit longer with the forehead area. But Julia comes all the way from Montreal. Appreciate you so much. Thank you so much for coming on. I'm glad you're doing much better. Your scars are looking much better from the last treatment we did. It's a second step, and I think it's going to be a significant improvement over there. Garid is saying, what would you recommend for really porous skin? I have some redness left underneath from acne as well. So actually, maybe it's rosacea, which I was referring to earlier. Double check to see. Is it rosacea that you have? It's possible. Is nicotine gum or pouches the same thing as vaping? So nicotine, what it does is it's terrible for something called angiogenesis, and it's terrible for peripheral vascular circulation. So really, really terrible for these tiny little blood vessels, and it shuts it down. So what ends up happening is that, let's say you have a wound, potentially like acne, and you're trying to heal that wound. You can't heal it the way you normally should, and you don't have the circulation to even heal it. And instead of it healing properly, it just leaves this gaping hole sometimes. So nicotine is terrible. It's absolutely terrible. It's really something that we should look at and see that like these things are poison that they pushed onto us, and it affects the rest of our body. But if you care about your skin, care about your health of the skin, just look at it and you'll see that your skin quality has decreased because of that use, and you'll see significant improvement just stopping it. You'll see after about 3 to 6 months, it improves a lot. He's saying, why does it seem pico laser isn't working on the second session? Are you, I'm not sure if you're one of my patients or not. It should be working even by that point. But I'm not sure. It depends if if you're someone else's patient, and I'm not sure how they're doing it and what protocol they're using. You have to suppress it really as well. Hi, Dr. Qazi. If I know what I need to do I need to do a consultation? Yes, you do. Yes, you do. We still have to do that consultation to determine what's the best treatment options really for you, because it's possible that we may need to adjust it, and I need to be able to see your skin, and you may not know like that some things need to be changed, and it's all possible, but we just have to see you in person or like face-to-face, some sort of face-to-face. Virtual is totally fine. What is the best way to get rid of years of farmer's tan? Tough, but you could actually do that Eucerin pigmentation cream I was talking about, and glycolic acid actually. Glycolic acid once a week. Do that, get Paula's Choice glycolic acid. It works really well, or any glycolic acid exfoliant. Try it actually, it works really well, it's cheap. And do that for like 3 months or so. Do that slowly, don't go too aggressive with the glycolic acid. A lot of sunblock also work very, very well. Let's see here, I know I missed some questions here, so I'll try to get to them. Can Tazarac help with atrophic scars? It helps a bit with the oil production, helps a bit with collagen production, so that's true, but a lot of times, a lot of patients have significant scarring or volume loss. It's not gonna help enough for that. Best treatment to improve texture and tone. Actually, I was talking about pico laser. Actually, it's a great option because there's no downtime really. So maybe consider that. I have a consultation in April. I'm getting on Accutane in March. How long should I wait to book my procedure? I could do those treatments on Accutane. I just want the acne well controlled, the oil well controlled. And typically, if you're going to go on, I would recommend just requesting something like a low dose or micro dose of Accutane. Maybe your acne is more severe than that, I'm not sure. But if you do a low dose and it's controlled with low dose, we could do it on that. What can I do for my skin? I am healing from Stevens-Johnson syndrome. I'm sorry you had Stevens-Johnson. That's a terrible skin condition that you ended up having. And I'm not sure, did you ever happen to go to the burn unit for it, or what happened with that? And how long ago did you have that? Raven is saying, hey, my skin starts getting texture around the cheeks and forehead whenever it's cold. How to fix it? It goes normal after. So what you may want to do is actually try to, first of all, just put a layer. I'm not sure which area you're in, which part of the country, but I grew up in Chicago, and sort of similar type of thing would happen. So what I found was actually you do need to have a bit of a barrier. So usually I'll put like Vanity cream on there, and then use actually a little bit of like Aquaphor as a bit of a barrier now. For like, I'm not sure, if you're in Chicago, that would make sense, and potentially you have to do that to help reduce that. So what is your opinion on clavicular style bone smashing? Is it bad? DB, I think that there's a lot of people who suffer from body dysmorphia. I think that I understand it. I think that a lot of people actually have it, and it could be okay. because people want to like get best improvement. They want to look their best. And there's a lot of people out there that would feel like, oh, maybe a little small tweak here and there. It'll be really nice if I could do that and optimize myself. And that's like, that's normal. That's okay. I think a lot of people have that, and there's like a low level of that kind of body dysmorphia. But if your body dysmorphia takes you down a route where you're getting a hammer and smashing it to your face, it's really something that is very concerning. Again, it needs to be something that someone needs to intervene. Someone needs to talk to you about this. And it's it'd be catastrophic, for someone's face. So there's a lot of better options. You could consider doing something that really could just be relatively easy, and just like potentially look into orthodontics. So talk to people. A lot of people don't recognize this, but you're looking at your face and you're obsessed potentially with your upper part of your face. But if you go to like a really good oral OMFS surgeon or so, maybe they could assess to see if there's something they could consider to do with either jaw surgery if it's really necessary, or just orthodontics, and see. But maybe like just adjusting that will help out with the structure and the development of your face. But absolutely never would I recommend somebody smashing their face with a hammer. It could be honestly catastrophic. And really the kind of things that these guys are talking about, they put people into this pipeline where they know that people are vulnerable and they're suffering, and they tapped into it and monetized it in a way that's scary, and like then they're funneling people into the alt-right, and they're now telling people to smash their face and go on crystal meth. The dude uses crystal meth, and he's telling people to go on it. And it's like, what is this world? It's like, there's so much of this which is just so surreal. And the way that these guys are like, you can see the bot activity and all this stuff, the way it's working, it's very clear that there's a whole nother level to this. There's a whole nother side to this, that they're putting people through, vulnerable people, into a pipeline. The same way Andrew Tate did, they're doing the same thing. No, he's saying to take crystal meth. He does say to take methamphetamines. I've actually seen him myself say this. He said to take methamphetamines. He said himself that he was taking methamphetamines for the purpose of weight loss. And he said it. He said that. I'm clear as day. He said that. And I think that's like, outrageous, really, to be telling people that. And I do agree, though, that things like amphetamines, he's saying, well, amphetamines are in like Ritalin and things like that, and that's what we use. But like the argument should be like, it's terrible that we put people on amphetamines for ADD. It's like, that's the actual argument. And it's like, that. I agree, that's terrible, I think it's illogical, and it's terrible. There's so many better options, and everybody has some form of ADD, and it's totally something that is just mishandled, and people are throwing little kids on methamphetamines. That's like the issue. But now it's not like, oh, because we do it for Ritalin, we should just have people use methamphetamines. Like, that's just terrible. So yeah, that's like, that whole looks maxing stuff is so concerning, I would say. It's true that he said that he is taking it, but he's clearly advised not to take it. That's awesome that he's saying that he takes it, but don't take it. But like he's saying, it works well for him, and it gives him clarity, and it gives him weight, and it helps him with his weight loss. So clearly, even if he's saying potentially, you saw a video where he says don't take it, it's pretty questionable now that somebody's promoting this for himself. Even really, methamphetamine use, it's like legitimately, I've seen so many people who've had heart failure due to methamphetamine use. A lot of people don't realize it, but you can cause right heart side failure. People need to be on something which is going to potentially lead to a heart transplant in some patients, legitimately. And it's a terrible drug. It causes brain damage as well. So there's so many different issues with it beyond just the fact that like it's damaging for just like your mental health and all the other aspects of it. It's just a terrible idea. And so absolutely not. And again, like the argument is so poor that, oh, because it's being used for ADD purposes, methamphetamines are used for ADD purposes, it's okay to use, crystal meth. Like, what are we saying right now? And smashing your face with a hammer. Like, how is this real life, right? Like, it's just like this weekend we saw now that these people are sacrificing kids, And it's like, this is the world we're living in right now, where people are talking about doing this stuff, and like it's just like open. It's like you never would have imagined ever like this was going to happen, and it's real life right now. So I stick with the things that are like the things that make sense. Smashing your face with a hammer is just like, think about that. It's like self-harm. It's just not going to make sense. There's so many better options. I agree. People want to improve their looks. There's so many different options. Of course, I also recommend doing things that are like collagen stimulating products like Bellafill, Sculptra, Radias. But there's so many other things you could consider doing. There's so many other possibilities that you could look at and see how to improve yourself. And maybe it just involves just eating healthier and being healthier, and definitely not doing crystal meth. As someone on Adderall for severe ADHD, I agree, no one should be taking it for weight loss. That's terrible. Yeah, absolutely. And that's exactly it. And that's a whole other subject. Honestly, I think that ADD is something that it really needs to be handled a lot better. It's really poorly understood, poorly discussed. And we just sort of just gave up on it and sort of just threw it here's some studies from a long time ago, and just give these people stimulants and it's going to work. And, I have, in my entire life, people said that it was like, okay, you have ADD. And it's like, I actually focus incredibly well when I'm doing my things that I like to do, and I'm using my hands. And it turns out that maybe it was just the things that I was doing were not the best for my way of studying and learning. And I think actually the same thing for a lot of people. A lot of people have a certain way of organizing their thoughts and thinking. And it's possible that the way teachers are presenting it isn't the best way for them. It's possible that they aren't designed, their brain doesn't work a way where it's just supposed to memorize things on a sheet of paper and then regurgitate that for a test, And that's really comical that that's what's viewed as a great student and someone intelligent, that's someone who just regurgitates stuff. And it's not actual intelligence. And it's look at these LLMs, like ChatGPT and Gemini and things like that. It's not actual intelligence. It's just regurgitating stuff that it just does. And it's people do, have this concept of what intelligence is, because there's certain groups of people. In fact, in these files, it describes the people who talk about how to do intelligence, and they're the ones that pushed the way that we think of intelligence. These guys at these files just got released. They have whole sections about this, and they're obsessed with believing that they're the smartest people in the world and all this stuff. They're obsessed with it, and they have to believe that. And it's there's so many different forms of intelligence. There's so many different ways that people are intelligent. So many people on my table are way smarter than everybody that I've ever seen from that list that just came out. And do you see the grammar errors that they had, the way that they were talking, the way they were thinking? It's everybody I know is smarter than them. Everybody I know. And these are the people that are running the world. They're running the world, and everybody I know is smarter than them and more ethical and better than them. Everybody in the world I've ever met. And I have done, I think, 25,000 patients or so, plus all the other thousands of people I've met before outside of this. And it's everybody I've ever met is better than them and smarter than them. Do you see their, just look at their grammar. Honestly, everybody that I've seen has better grammar than them. And it's their grammar, they don't even know how to spell basic things. And they're the ones ruling the world. These guys who are, they're sacrificing kids. They're the ones ruling the world. And really, they're the ones ruling the world. That's something that we're sitting around, we're okay with, that these are the guys that are doing this. And we're looking at this and thinking to ourselves that these dudes that can't even spell correctly, can't even formulate thoughts, and are sacrificing babies, they're the ones, that are running it, and we're okay with that. Crazy world we live in, yeah. And these guys are running around, and now we're talking about people that are looks maxers and talking about smashing your face with a hammer and taking crystal meth. This is the world that is. And they're putting people in a pipeline. They're doing Heil Hitler at clubs, and they're putting people in this pipeline. They're putting people in a pipeline. It's all designed. It's all organized. Did you see that Epstein ran 4chan? He was the dude behind 4chan. He was the dude that was running it. And Jesseline was running Reddit. She was a super mod on Reddit. And so they had the people that were the Democrats and the people that were were the Republicans, and it was all the same people. And it was all the same stuff. And they were just doing the stuff to spread people and cause so much division. And the funny thing is that we're all aligned with the fact that we fucking hate pedophiles. And they really, couldn't understand that concept. It was tough for them to realize this. And they don't understand that that's what this is now. That it doesn't matter what line you're on right now. Doesn't matter what you're doing. we're like, you're like wearing like these hats still. You're like supporting a pedophile now. That's what this is. You're not even just a pedophile. This dude, like, he's tortured little kittens for fun. He like did like the stuff that he did is absolutely insane. It is so sickening. And it's like, that's what you are now. And like, that's the divide. That's the line. And I don't even care if you don't come to me and you're a maggot supporter. I don't care. Like, I'm actually happy that I'm not seeing you. I'm not going to treat your scars. I'm going to put that down really clearly. And I'm like, good, leave, like, and don't be on here. That's totally fine. That's totally cool, because it's 100% clear that all these things that were happening and you're still supporting it. It's just like, you know what? There's a line. There's a complete line. And every single time that the moral question has come up, you failed. And like, maggots could be gone, you know? And it's just like, I'm not interested in it. And like, just goodbye. And you know, at this point, you're still doing this and you're still looking at it and you're still looking at like, this world as it is, and you're still supporting this stuff. You really are supporting a pedophile and supporting pedophilia and torture. And honestly, they're eating babies, okay? They're eating baby flesh. And so it's like, what the hell are you supporting? That's what you're supporting. And maybe you got like confused when you elected him and you were like so like stuck in that world and you believed in it and you really did like go down this alt-right pipeline, all this stuff. But at this point, it just doesn't matter. I don't care. Nobody cares. You support a pedophile. That's what it is. And so it's like, that's it. And so like, we don't like need to even look at people like Kavikler who are giving Heil Hitler like stuff and talking about like, and he was supporting Trump and all the other things that he's doing. And the same thing with Eden Ross, all these clowns, all of them. Like, honestly, all these guys are sick, and it's a toxic culture that they're pushing out here right now. All these guys. And it's just, it is what it is. You know, that's the truth of the matters. And really, we should stick with our own community and building it up and making sure that our own world, we have less people who are suffering, less people that are feeling like they're isolated and alone. My patient today, you know, he came in and I've seen him before, and he's telling me, I'm like, how's it going? He's like, you know, it's okay. Worried about ICE, you know? And like, still, of course, we're gonna help them. We're gonna take care of these things, but we need to make sure that like, we're like asking people and working with people and making sure that the people that are more vulnerable are safer. And that's the thing, that all of us have a position of power over someone else. You could see it, and you should figure out who has less power than you, who is suffering more, and try to work with them, try to support them, try to find ways to support them. You have to do it. And it's like, that's the only way to combat what this is. Everybody like is gonna look at this and say that there's no way to fighting this, there's no way of fighting this, but the truth of the matter is that this space proves that most people, the vast majority of people, are actually some people that want to cooperate and work together. There's very, 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 very few people that want to actually manipulate and control people. And everybody that I've known, and I've met tens of thousands of people, is better than the people leading us, is better than elites. Everybody. So what are we doing with them? Right? What are we doing with these guys? Why are they ruling us? Why is it okay that they're ruling us? And the thing is that I'm saying this right now. I'm saying this openly on my platform with my face. I'm saying this clearly because there's nothing you guys should be scared of anymore. It's over for them. It's game over. It's game over. It doesn't matter what happens, what like the things of this battle that they're doing. They lost the long game and they lost the short game now. It's game over. So at this point today, all the people that are stressed out and worried, just realize that there's a lot more allies than you realize. There's a lot more people that will work with you, and there's a lot that's going to be done now. There's a lot of people that are going to, a lot of things are going to be solved. And it's just, we're going to work on it. And all of us, all the people in this that are like, that we met are better than the people ruling over us. And that's a crazy thing, right? What the hell are they doing ruling over us now? Anyways, that's it for me tonight, guys. I appreciate everybody. I will see you again tomorrow. Take lots of care, okay? We'll see you guys. Take care. Let's see how I cancel this thing.
I just don't know if it stopped. Oh yeah, wait, let me check YouTube.
Oh, still going.